This is the largest Ebola outbreak in history and the first to hit West Africa. The World Health Organization says it will take thousands of additional health workers to fight it. Joining us now from the U.S. state of Georgia is Dr. Steve Monroe. He's the Deputy Director of the U.S. National Center for Emerging and Zoonotic Infectious Diseases with the U.S. Centers for Disease Control in Atlanta. Dr. Monroe, thanks for joining us.
You're welcome. My pleasure.
There is a rather disturbing report in the New York Times on Wednesday. The president of the organization Doctors Without Borders, Médecins Sans Frontières as they're known, he describes the Ebola outbreak in West Africa as a, quote, complete disaster. What is your assessment of the outbreak?
This is certainly the largest and most unprecedented outbreak of Ebola ever, and it is going to take a concerted effort among multiple partners to bring it under control.
Where is the disease most prevalent right now?
Right now, the two main countries of concern are Sierra Leone and Liberia, that are both showing an increased number of cases day to day.
Now, you have an emergency operations center which is operating in the region. What are they doing?
So we have an emergency operations center here in Atlanta that is coordinating our efforts, both of the teams on the ground there in the countries, but also our efforts here in the U.S. to make sure that we're prepared in the unlikely event that a case was introduced into the U.S.
So is this mainly an exchange of information between what's happening on the ground and how you assess it here?
Well, it's also preparing our staff to deploy. We currently have over 60 staff that are in the four countries, including Guinea and Nigeria, as well as the other two, who are working on the ground to assist the Ministry of Health and the World Health Organization in their efforts to fight the outbreak.
Right, and these teams that you have on the ground, what kind of challenges are they facing?
Well, our teams primarily are involved in about 4 different activities. One is the case identification and identification of contacts, which is essential for interrupting the chain of transmission from person to person. The second activity, which is crucial, is the health communication, health education, getting the word out to people about what Ebola is, what it isn't, trying to allay some of the fears in the communities. The third is involved with the assisting the local authorities in their efforts to do exit screening to make sure that an infected person doesn't get on an airplane and spread the virus somewhere else. And finally, it's involved in trying to assist the local countries with their efforts to set up the same sort of emergency operations center that we have here so that they can better coordinate their activities on the ground.
Well, I'm wondering how difficult it is to establish a surveillance system on the ground there to detect if and how the virus is spreading.
You're right, it's a bit of a challenge to do accurate surveillance in these surroundings, and particularly when in the rural areas there are communities that are resistant to identifying cases out of fear or out of fear of the unknown. And so part of the effort is this health education to make sure that people know what Ebola is and are willing to come forward and identify cases.
Right, and one of the strategies we've heard is that the best course of action right now is to confine or contain the disease. How is that working?
So quarantine shows limited utility in most cases because it's difficult to enforce. And importantly, if it is tried, there has to be a concerted effort to provide the people who are in the quarantine area with the basic needs of life, food and shelter, things like that, so that the people can go on with their daily activities. But we feel it's better to identify cases quickly and get them into a treatment facility. Unfortunately, right now, the limiting factor really is the capacity of these treatment facilities because the number of cases is so large.
Now, we've heard that some of the medical personnel involved in this work, people trying to save lives, have themselves become infected. So what does an organization like the CDC do what kind of precautions do you take to safeguard your workers?
That's right. Unfortunately, in this outbreak, a large number of healthcare workers have become infected. And many of these are people who have the first encounter with a case before they reach one of these treatment facilities. And so they're assisting these patients with very rudimentary medical precautions. So one of the things we're doing is trying to both train people in proper infection control techniques, and then also make sure that they have the appropriate protective equipment, gowns and gloves, and wear appropriate masks so that they can better protect themselves and won't become infected.
And what kind of medical facilities are there in West Africa itself to deal with an outbreak like this?
Well, one of the things this outbreak shows is that these countries in particular had very fragile healthcare systems to begin with, and the Ebola response has just completely overwhelmed their capacity to deal with things. And unfortunately, it's having this cascading effect where now we're concerned that other people aren't getting medical care for things that are not related to Ebola because, one, the healthcare facilities are overwhelmed, and two, because people are afraid to go to healthcare facilities because they're afraid that if they go there, they might contract Ebola. And so it's having an effect on other kinds of things, including malaria, natural childbirth, and other health issues like that.
And I'm wondering what kind of a challenge you face when you look at, the region, the fact that communications are not the best, and when you look at people moving across national borders, and these are border posts that they're moving across, some of them in very remote parts of West Africa.
Most of these countries have tried to institute some sort of border control to keep people from going back and forth across the land borders. And it is very difficult, as you point out, because the areas are quite remote.
Dr. Steve Munro, thank you for joining us, sir.